going to the hospital, you're not alone if you get a little anxious. I get anxious.
Certainly I do. That's partly why Kaiser Permanente has a new tool to try to treat patients. It's not a pill or a drug.
And Marla Tejas is here with the details. Good morning, Marla.
Good morning, you two. Alex and Megan, the best part about this is the price tag. There isn't one. This treatment doesn't cost a thing. Now, we all know the saying, laughter is the best medicine. That might be true, but there's a lot to be said about music. Case in point, what I witnessed at Kaiser Permanente's main campus in Los Angeles.
I highly recommend it as a way of dealing with the trauma of having a disease.
It was 2010 when Riner Scivally found his life turned upside down when he was diagnosed with Burkitt's lymphoma, an uncommon and aggressive type of non-Hodgkin lymphoma. Near daily chemotherapy sessions at this Kaiser Permanente in Los Angeles would become the routine. But what should have been grueling and exhausting, well...
It was bearable. It was very good.
It was bearable.
Yes.
All really thanks to your guitar.
Yes.
A musician at heart, Riner decided to bring his guitar to his treatments, and it didn't take long to note the benefits.
The ones with the guitar and with the music went much better. It made my mood more positive.
This just becomes another tool in the physician's toolbox.
Dr. Michael Cantor initiated a study that looks at the power of listening to music before or while undergoing any number of procedures, from chemotherapy to a colonoscopy. In 2017, what they found resulted in Kaiser Permanente instituting what it calls music medicine interventions. And since then, thousands of patients have been positively impacted.
Having music deliberately given to the patients makes them less anxious. Pain can be less. So you're encouraged to basically bring your own music.
It is that simple. Patients either listen to music on their own device, whether that's a cell phone or an iPad, or depending on the situation, staff may provide the music in a private appointment.
And when the nurses do their vitals, their blood pressure is lower than before.
Oncologist Dr. Tiffany Hogan says the music intervention makes her job easier too.
I think that's the key in cancer treatment, is that they're calm, they're relaxed, they're positive.
The music helped Riner so much he's decided to pay it forward with his guitar. So about once a month he comes back to Kaiser where he plays for other patients going through their own journey. Patients such as Kent Morimoto, whose colon cancer has him here 5 days a week for radiation.
It's the first time I've heard it, but it's great. I mean, it's very soothing. Kind of takes your mind off of, the hassle of coming in every day.
It must make you feel
It's
really
very
good inside.
It does, it does.
Enough to keep Riner, now almost 10 years cancer-free, stringing his guitar for those who need it even more than he does now.
I'm kind of happy that he's, has a kind heart and he's, just donating his time.
So the music medicine intervention program is widespread throughout all Kaiser Permanentes in Southern California. Also worth noting here, Dr. Cantor says in some cases, music medicine intervention helps reduce the amount of pain medication a patient is prescribed. So it's healthier all across the board.
What a beautiful thing. What a
Isn't
great
it nice?
story.
Great
and
story.
Riner, he gets requests for songs. People ask him for his card. It's just really wonderful.
Yeah, way to